Dr. Richard Fortis.
Good evening. Thank you all for staying so late and listening to everyone's testimony today. My name is Dr. Richard Fortis. I have a doctorate in biomedical sciences. My PhD dissertation was focused on reproductive biology, and I received my degree from the University of South Carolina School of Medicine. My dissertation involved biomedical markers that would help determine which embryos would implant versus which embryos would not in the field of IVF. I have been an embryologist performing in vitro fertilization and helping patients create families for the last 22 years, and I am currently an IVF director. I came here today to represent my colleagues and my own concerns about how the unintended consequences of this personhood bill may affect IVF patients who are trying to create families that may not be able to by other means. I am also a Christian. My wife and I have struggled with infertility for 10 years, and we were also IVF patients, which gives me a unique perspective that most people do not have. We have had several failed IVF cycles, but we also currently have embryos stored for future use, and we are not alone in our struggle to have families. We're also fortunate to have two beautiful adoptive children. 1 in 8 couples in the U.S. currently struggles with infertility. In fact, 1 in every 50 births in the United States is from assisted reproductive technologies. That's 2% of every birth. There are women born with genetic conditions which do not allow them to carry children. There are war veterans that require IVF for various reasons. There are oncology patients requiring IVF in order to preserve their fertility prior to the treatments that may render them infertile. My colleagues and I are concerned about the unintended downstream effects that this bill would have on a significant portion of the population, for some of whom their only route to having children is through IVF. This would directly counter the spirit of this intended bill by potentially preventing individuals who want to have children from being able to do so. Many physicians, nurses, and embryologists and other reproductive medical professionals are members of the American Society of Reproductive Medicine. The society is strongly opposed to any measures granting constitutional rights or protections of personhood status to fertilized reproductive tissues. If approved, the measures like this will have significant effects on a number of medical treatments available to women of reproductive age. Personhood measures would make illegal some commonly used birth control methods. Personhood measures would make illegal a physician's ability to provide medically appropriate care to women experiencing life-threatening complications due to tubal pregnancy. Personhood measures would consign infertility patients to less effective, less safe treatments for their disease. And personhood measures would unduly restrict infertile patients' rights to make decisions about their own medical treatments, including determining the fate of any embryos created as part of the IVF process. ASRM opposes any personhood bill that is unclear, confusing, ambiguous, or not based on sound scientific or medical knowledge, which threatens the safety of effective treatments of patients. I need to finish with one comment. There are things that I know that I can't encompass in 3 minutes, but I want you to know this. Just because a sperm and egg come in contact does not mean the resulting tissue is compatible with life or will become a person. Not all fertilized eggs are compatible with life, and therefore not all fertilized eggs will form an embryo or a person. Not all fertilized eggs will cleave or form an embryo or a person. Not all embryos are capable of producing viable pregnancies resulting in a person, and not all embryos are genetically normal, and some genetic conditions will not result in a viable pregnancy or result in a person. I know this because I've handled tens of thousands of human embryos. Don't make this across the board. Think about the IVF situation. Think about what will happen if you put wording in terms of the letter of the law that will make IVF potentially something equated with abortion, which it is not. Thank you for your time.
Thank you, Doctor.